Hello everyone, my name is Dr. Dhanashri Peddawad. I am consultant neurologist. I am working in Medicover Hospital, Pune. So today on the occasion of World Autism Awareness Day, I would like to talk about autism. So let's discuss what is autism. So first of all, autism is a disorder related to its brain's development where a patient has problems in communication and also social interaction. Okay, so basically this developmental disorder creates problems in patients where there is a problem in perceiving how patient perceives and how patient interacts socially. That is affected very much significantly. So it also has patient also has repetitive patterns of behavior, sometimes repetitive motor actions in that. So overall it has wide range of symptoms, and together it is called as autism spectrum disorder. It also includes a syndrome called as Asperger's syndrome. And so the main characteristic of autism spectrum disorders are, first of all, they have a problem. Patients will have problem in social interaction, they will have problem in communication, and also they will have some repetitive patterns of behavior. So it can be various different patterns. So how we, considering these three important features, how do you identify these? First of all, there is an age of presentation. So usually the children, you will observe these symptoms, the changes in the behavior and the interaction in the very first year in the children. Okay, so from birth to 1 year of age, and or in the second year of age, like from between 1 year to second year of age. Sometimes there will be a developmental regression, so like loss of milestone. Somebody who sometimes the children who start speaking, they will lose their language after a certain time. That we call it as a regression of a milestone. So these can be the features. So out of these three important characteristics, we will now see first two, that is social interaction and communication. So what are the problems or the symptoms in these two categories? So you will see the child will have poor eye contact. They will have less expressions. They may avoid looking at you, and they can be like delay in the response. If you call their name, there may be delay in looking at you and responding to your calling name. Also, they may resist cuddling or holding them. They may not like it. There will be also problems in understanding others' expression or others' emotion, and also they themselves cannot sometimes express their own feelings. Also, there will be a specific tone or a lack of expression to their language. Sometimes they can repeat some words or a typical sentence. So these are some typical symptoms in we call it as poor social interaction and communication. Now the third part of these important three characteristics is repetitive patterns of behavior. So what the child will do, they will have typical repetitive motor actions like hand flapping, sometimes spinning, sometimes rocking behavior. Also they can harm themselves. So it can be a self-harming behavior, they can bang their head on the wall. Also they can bite themselves. So these are some of the typical repetitive patterns. Also they can be typical rituals they follow. They like to do things in a particular way repeatedly, and if it gets interrupted, they will get annoyed and disturbed. Okay, so these are some repetitive patterns. Also there can be behaviors like they would focus on a particular detail of a object rather than its use. Like suppose there is a toy, they will keep looking at a certain part of a toy, like there is a toy car, so they will keep looking at a wheel of a toy car, and rather than its utility or how it functions. So it is like that. Also, they can be child can be more sensitive towards sound or particular provocation, but they can be insensitive towards pain stimuli. So this is like a very typical in them. So these are some typical patterns of behavior which they repeat frequently. So when to see a doctor if you have doubt that your child is suffering or having some symptoms of autism? How do you identify and when to consult a doctor? So if your child is it's not smiling, there is no smiling face by 6 months of age, there is no happy smile, then you should probably think of that. Or if there is, if the child is not mimicking your expression or your facial expression by 9 months of age, or if the child is not babbling by 12 months of age, also if child is not saying a single word by 16 months of age, then probably you should consult a doctor. Also, if there are some symptoms like what I have discussed earlier, if you find them, then you should consult a doctor. Now we should know what is the etiology, what is the cause of autism. Mostly it is been believed that it is a genetic cause, and then there are some environmental causes. In environmental causes, it can be mostly during pregnancy. Either there is a viral infection or some complication during pregnancy, or there are some other drug exposures. So all these are probably some part of some we may not completely attribute, but probably these are some other causes of autism. So what are the risk factors usually associated with autism? We have seen that male children are more likely to have autism, like there is a 4:1 ratio. Also, if there is a family history of autism or autistic spectrum disorder, then there is a chance that the member of that family can develop that. Certain disorders, in like if there is some developmental disorder in a child, then that child can have a autism. That child is more likely to have autism spectrum disorder. If the child is preterm, a very early preterm born child, and also a elderly primary or a age of the parent. If the parent's age is they are elderly, then it is more likely that they can have an autistic child. So what are the implications or complications of these autistic disorders? Like you will see these children will have learning disability. There will be problem in learning at school. It is very difficult for such children to in a normal school to make them understand and give them a proper education. They will require a proper care and one-to-one interactions so that you can improve their skills, social skills and communication skills. So also there will be a problem in employment. Such autistic children, once they grow up, they will find problem in getting employment because of their lack of social ability also, and communication problems. And again, there can be problems at home because of their ability to interact with the family members also. There can be stress, sometimes loneliness. So all these problems can be seen because of autistic spectrum disorders. And how do you deal with such situation? How do you treat So there is no cure, sadly, for such patients, but if you identify very early, we can start therapies. There are different types of therapies which can help and make a tremendous change in patient's life. So what are these therapies? We call it as behavioral therapies. So once you identify, you have to start these therapy, and there will be sessions at regular intervals, and patient will be taught communication and behavioral therapies. Also family therapy, even the family members will be taught how to interact and what to do in such special situation. There will be educational therapy, which is usually implicated at schools, of course. So these are the different types of therapies. Apart from that, there are other therapies, special therapies, or play schools and different like we call it as audio speech therapy, physical therapy, which may be required to give them a wholesome experience and a treatment. So overall, it is not a dangerous situation, but we should identify early and start these treatment as early as possible, so as to give a better life to the children. And also the parents will have an idea how to interact and how to deal with such children in a later ages also. Thank you.